Howdy folks, how we doing today? It is Monday currently, and I just wanted to give you an update as we are now less than 2 weeks from race day on what I've been doing these past couple days. So last talked to you about Thursday and Friday's run. I didn't run Saturday, and Sunday I tried to run, but I kind of felt like garbage. And that's kind of typical of my Sundays. I just usually try to do like a light shakeout. So I broke it up into 2 light shakeouts yesterday, and I don't know, I wasn't really feeling it. I wasn't in the right mindset. And so ran 4.5, I think, yesterday, or 4.5. Real easy, and that was fine, whatever. And just mainly in preparation for today's run on Monday, which was also not too crazy. I went to Central Park and did almost 8 miles, which you can see there. It was at a decent pace, 7:30 pace overall. That was with a really pretty slow warm up. But I did stop for a good, I don't know, at least 10 minutes, probably longer, like 10-15 minutes, about 3 miles in to stretch out, because I had that compartment syndrome coming back into my anterior compartment in my lower leg. So that's annoying. I'm not overly worried about it because it tends to only happen when, 1, I'm not warmed up sufficiently, 2, usually early in the week when I've taken a day or 2 off from like hard running, and then I try to get back into it, and then 3, on flat hard ground. So that's why I'm not worried about it for the race. I don't think any of those things are going to be a major problem. I mean, granted, I won't be running hard before the race, but I'll make sure to warm up pretty sufficiently, and I'll be going at a much slower pace. Even to start off the race, it'll be soft ground. So I really don't anticipate having any compartment syndrome during the race. But I'm just going to show you a little bit of an animation to depict what is actually going on with compartment syndrome. This specifically, since it has to do with running or physical activity, is known as chronic exertional compartment syndrome. Chronic because it comes back every time you try to run, or not, in my case, not every time, but frequently over several months. And this isn't a super common problem that runners face, but it is out there. And so I don't know, maybe someone who watches this video might have experienced something similar before. But essentially, in my case, there's a couple of muscles in your anterior compartment of your leg. There's actually 3 of them. One that is focused on extending the large toe, your big toe. One that is focused on extending the other 4 toes, and then one that is focused on flexing the entire foot, as well as inverting it, which means kind of like turning it inward, turning the bottom of your foot inward towards your center. And I think the main muscle that is probably, well, it's the entire compartment, I guess, but the main muscle that is probably experiencing the highest load when you're running is that last one that I just mentioned, the tibialis anterior, that's responsible for flexing your foot upward and inverting it. And what happens is essentially or at least, this is thought to be the mechanism of action, more or less, is that your muscles, they start working, and they expand as more blood gets into them, and they start contracting more and whatnot and doing work. That's sort of pretty much the basic premise. And over time, they expand, and they are actually held together in this sort of layer of tissue called fascia. And that fascia just kind of holds all your muscles in one compartment together so that they can act in unison, essentially. That's kind of the general gist anyway. So as your muscles get more blood flow and do more work, they'll expand more and more, and that fascia, if it's not large enough, essentially, can constrict the muscles and cause them to compress on your veins. That compression on the veins actually prevents blood from exiting the muscles and the compartment. And since that blood is not exiting the compartment, blood from the arteries cannot enter the compartment because the pressure is too high and there's not enough space for it, essentially. And over time, that causes, as you do more and more pounding while you're running, that causes your muscles to start to feel oxygen deprived, like as if you were like lifting or doing sprints or something over time, just in this one, your anterior compartment here. And in my case anyway, and in the case of most runners, you'll get more and more oxygen deprived. You could start to compress on the nerve some from the pressure, which I do experience as well, which will cause a tingling sensation in the muscle. And then you'll eventually, either because of the lack of oxygen or because of compression on the nerve, or perhaps some combination of both, you might actually start to experience minor paralysis or a lack of ability to flex some of those muscles or contract some of those muscles essentially, which in this case means dorsiflexion of the foot no longer becomes possible. So essentially, this is dorsiflexion, by the way. While I'm running, over time, over the course of a mile or 2 miles into my workout, I eventually lose the ability to flex my foot upward, and I begin slapping my foot when I'm running. And it becomes more and more painful within the muscle over time. The longer you go, kind of the more painful it generally tends to get, until you eventually stop or slow down sufficiently for the pressure to decrease and for you to be able to, pretty much for the muscle to get oxygen. So that's no fun. So pretty much, I actually found a nice paper that detailed a couple of ways to sort of help with alleviating compartment syndrome that's been shown to work in at least 2 runners. They did 2 case studies and were actually able to help reduce the pressure in their anterior compartment by doing these exercises repeatedly over the course of a few weeks. And these 2 runners actually had a much worse syndrome than I did. Like, they were experiencing the syndrome within 3 to 5 minutes of starting running every single time they ran. Whereas for me, it was worse a few months ago. Now it's probably like once, maybe twice a week, depending on how fast I'm going or whatever, and some other variables. But pretty much a couple of things you can do. The main thing, the number one thing actually, or I guess there's 2 number one things, is 1, increase your cadence, which is, I've already been working on. Increasing your cadence causes you to, while bringing back down your stride length a little bit. Having a reduced stride length with increased cadence will cause you to put less pressure and land with less pressure on your foot, which will cause lower pressure within your entire leg, pretty much, and you won't require as much blood in your legs, and your muscles won't be working as hard, so they won't expand as much. Or at least some combination of those things will help alleviate some of the compartment syndrome. The other main thing is to land on your forefoot, or at least your midfoot, rather than your heel, which I've already talked about a little bit before as well. And it kind of goes a little bit hand in hand with the cadence work. They both, if you do one, you're probably going to, at least to some extent, do the other one as well. So these are things you can kind of work on simultaneously pretty easily. And this is what I've been trying to do over the past couple of weeks. Along with preventing compartment syndrome, these 2 tactics have a lot of other health benefits for when you're running. So some of the exercises you can do to help with this, besides just focusing on improving cadence, is in the paper that I found. So, and they seem to make sense to me, at least anyway. 1 is you can just stand like this and then practice shifting your weight forward on your heels, or from your heels to your toes, I should say, and just shift back and forward so that you get better at actually detecting what it feels like to have pressure on your forefoot versus the back of your foot, versus your heels, essentially. And that will help you concentrate on landing on that forefoot, or at least midfoot, while you're running. So you can just do that a little bit, for a couple minutes or so, a few times a week, and in no time you'll start to get more sensitive and get more used to that sensation of being on your forefoot. It's pretty subtle. You don't need to be falling over. But for this exercise, you do. Exercise number 2. So you actually get close to the wall, and you're pretty much going to do the same thing, except instead of just shifting your weight, you're actually going to, let me make sure you can kind of see, you're just going to fall forward, and then catch yourself with the wall. And this will get you more used to running essentially while falling. Because if you lean forward more and can shift your weight forward more while you're running and have this sort of forward running posture, that's actually going to cause you to, one, have a quicker cadence, and two, land on your forefoot. And this is how all of the pros run. Not that you're trying to be like a pro, but just to show that to be a pro, you generally have to be at least somewhat healthy or be doing things to maintain your health. So I definitely think, you know, this is like a good thing. It's a good thing to have a little bit of the sensation that you're falling. Although it will pass over time as you get more used to it, it won't feel so much like that. But if you can just, while you're running, keep a forward cadence, or a forward posture, I should say, sorry, that will help with these symptoms. So those are two like really easy ones to do in your room. Just practice balancing and then catching yourself right before you hit the wall. And do that, you know, several times. One other thing that you can do that's pretty easy that you don't need any other equipment for is just here. I'm wondering how I can show this to you best. Maybe it put the camera here. There we are. Is lifting up your legs via your hamstrings and then just letting gravity lower them, or lifting up your feet with your hamstrings and just letting gravity lower them back to the ground, not actively lowering at all. So like, just like that, or from behind too. Raise, let gravity lower. Because if you lift with your hamstrings, rather than pushing off with your feet, this will actually save the muscles in your legs, in your lower leg, from working so hard, because you're doing more of the work from your upper leg, which generally does not. It's very uncommon to have compartment syndrome in your upper leg, unless I think it's pretty much impossible from physical activity. But the more work you can shift to your hamstrings, rather than from pushing off your feet, the more it's going to save that anterior compartment from the pressure buildup over time. So just lift and let fall. Lift and let fall. And if you do that, then when you go outside and actually run, try to focus on that. Amongst other things, take some time, when you're feeling that forefoot sensation, trying to get that forefoot landing down. Also pay attention to your hamstrings and try to lift off, rather than push off your foot, lift off with your hamstrings. It's something you can kind of feel. It's subtle, but I think you'll be able to notice if you concentrate on it. So I think that's good for now. There were one or two other exercises, one of them that you need equipment for, but I think that's good. I want to keep this a little bit short. That's all I want to say for today. Just giving some tips on how to alleviate that compartment syndrome. If you're having it like I am, don't worry about it if you're only doing trail running and whatnot, or you have a trail race coming up, because you probably are less likely to experience it. At least I know I'm not worried about experiencing it on the trails. In fact, today when I ran, after I stretched out, I still had a little bit. I'm still feeling it a little bit in my anterior compartment in my lower leg. Those like that tiredness and that oxygen deprivation, until I got to the hills and I started I did 5 hill repeats in the north woods of Central Park. And by the time I was through one hill, maybe 2, 1.5, somewhere like that, it was completely gone. So just getting onto that soft ground and doing the shorter stride, quick feet, being on my forefoot up the hill, that like got rid of the compartment syndrome like almost immediately. So this is more of a sort of problem for road running, I would say. But yeah, definitely not something you want to take lightly and want to try to get rid of as soon as possible. At least that's what I'm doing. So thank you for joining me today, and I'll give you guys another update later this week.